Today we're going to talk about neonatal thermoregulation and the transitional period after birth. So the first 12 hours after birth, the newborn is going to be adjusting to extrauterine life. And a big part of this adjustment is going to be in maintaining a stable body temperature. The body temperature of newborn infants depends on the heat transfer between the infant and the external environment. Factors that influence heat loss to the environment include the temperature and humidity of the air, the flow and velocity of the air, and the temperature of surfaces in contact with and around the infant. So the neutral thermal environment is the ideal environmental temperature that allows the neonate to maintain a normal body temperature to minimize oxygen and glucose consumption. So who is at risk for hypothermia and cold stress? This is in the event that neonatal thermoregulation is not properly taking place, and that's really everyone. All newborns are at risk for hypothermia and cold stress, and that is why it is vital as a nurse to perform interventions in order to prevent cold babies. We want our babies nice, warm, and pink. But who more so is at risk for hypothermia and cold stress, and that's going to be preemie babies. Preemie babies have a decreased amount of brown fat. Brown fat is the method that newborns use to produce heat themselves. They break down and metabolize that brown fat. Brown fat is unique to newborns and actually has a richer, more vascular nerve supply than ordinary fat. And the heat produced by this intense lipid metabolism can warm the newborn and increase their temperature. So when you don't have all of that brown fat to metabolize, it can lead to temperature dysregulation. And the temperature that we're kind of looking for, we want to see it above 97.8 degrees Fahrenheit. Ideally, we get really super excited when the temperature is above 98, but truthfully, anything above 97.8 does not place the baby at risk for cold stress. So cold stress happens after the newborn experiences heat loss. And the newborn can experience heat loss in 4 different ways: conduction, convection, radiation, evaporation. So with evaporation, the loss of heat occurs when a liquid is converted to a vapor. So we don't like wet babies. We want to make sure that immediately after birth, we dry them off. And after their first bath, we immediately dry them off. We don't want them to be wet for any extended period whatsoever. Immediately, any wetness on their skin needs to be dried and they need to be wrapped up to prevent that evaporation and heat loss from their skin. So the interventions are going to be dry the baby very quickly and put that baby on skin to skin. The second mode of heat loss is conduction, which happens through direct contact. It's the loss of heat from the body surface to cooler surfaces that are in direct contact. So conduction, direct contact, you can make a connection there. So the interventions to prevent heat loss in this way is to provide a protective cover on the scale. So you're going to be weighing these newborns, and that is a cold scale. You can provide a warm blanket on the scale to prevent heat loss from the infant to the scale. Also, a pre-warmed bed is an important intervention, basically always with newborns, to prevent heat loss, especially in that immediate period when they're adjusting to extrauterine life. The third method of heat loss is convection. So in this method, the flow of heat from the body surface goes to cooler ambient air. So the newborn is going to be losing heat to the air. So you want to protect the baby as much as possible, and that's basically by leaving as little skin exposed to air as you can. So go ahead and put a hat on it and make sure you put a tight swaddle on the newborn, and that's going to adequately hopefully protect them from convection heat loss. The last method of heat loss is radiation. So radiation is when you lose heat to a cooler surface, but it is not through direct contact. It's just relative proximity. So anything that is close to the newborn, such as the side rails or a window. So some nursing interventions to prevent heat loss from radiation is to place the baby away from windows and away from air vents. And once again, you're going to want to preheat that bed.